I would like you to meet the arthritis family. The arthritis family here has 3 children. The oldest is Osteo. Now, old Osteo, he was a football player. He had lots of trophies and pictures of him. But you know what? All that wear and tear on his knees, and it just became bone on bone. It wore off all of that cartilage and made it just bone on bone. So it's creak, crack, pop, very painful. The treatment for it is hot and cold, analgesic rubs, oral analgesic, anything you can. This is just wearing out. And old sports injuries or injuries of any kind can certainly be part of that osteoarthritis. Remember, osteoarthritis, not osteoporosis, different. This is osteoarthritis, and this is very common with age. If you live long enough, we're probably going to get it, because in our joints we have a hyaline cartilage that coats each joint so that it's not bone on bone. But wear and tear, lots of especially football players, they all have this. So then it becomes just the actual bone sitting on that bone, and it grinds, and it's quite painful. Okay, there's not a whole lot we can do about it. If it gets real bad, of course, they have knee replacements and so forth. But for most folks, it's going to be hot and cold, analgesics, that kind of thing, right? Next member of the family is Rheumatoid. I have her as a girl. Old Rheumatoid is the middle child, but she is a girl. And the reason for this is more men tend to get this, more women tend to get this. Now, obviously women get this and men get this, but more women get rheumatoid than men. Interesting, huh? This is autoimmune. This is when your own immune system is all fired up and hot, and it's attacking, it's finding something in your body that thinks is the enemy and going after it. So maybe it's this joint or this joint. Your body believes it's the enemy, and it's all out assault and attack on it. Lots of inflammation, lots of pain. It damages other organs as well. So it's an autoimmune, your body is fighting itself, and you end up with a total joint destruction. It's really quite bad. It needs to be addressed. So again, red hot and swollen joints, it's systemic. It can happen other places in your body, throughout your body. Okay? Now, what do we use to treat this? Humira and other biologics. Now, some of them are injectable and some of these are oral. They can be pills. Tecfidera and such like that are oral. Humira is injectable. These are extremely expensive, like a few times more than we make a year. Expensive, extremely expensive. Now, your book doesn't address these, but I'm bringing it up to you because if you have a resident that's on one of these biologic, please be very careful, because one pill can run $150, $300. So don't drop it, okay? But your book does not address these. The book is too old. They haven't updated it. Not a fan. But I just want you to be aware of this. Next thing, methotrexate. You'll still see a lot of people on methotrexate. Methotrexate actually was one of the very first chemotherapy drugs. Yeah, think about it, chemotherapy. Doesn't it push back your immune system? A lot of people who are on chemo have a destroyed immune system. Well, here in this instance, we want to push back that immune system. We want to hold it back, because it's all hot and confused, and way up here it needs to get cooled off. Okay, so methotrexate is another one. Plaquenil is another one. And occasionally you'll see steroids, especially if they have a big flare-up. They may be put on a steroid burst, and remember what that is? That would be something like prednisone. If it ends in a zone, you probably have a steroid. So In a steroid burst, you're going to take several pills that first day, maybe 5, 6, 7, okay? And then the next day, you're not going to take quite as many. And then the next day, not as many. And then you might repeat that another day. And then maybe 2, 2, 2, and then 1, 1, 1. And that's called a steroid burst, where you're taking a little bit less every day. And the reason for that is, and we're going to talk about it later, but steroids can be dangerous if they're taken for a long, prolonged period, or if you don't taper them off. So that's rheumatoid, the only girl in the family in the middle there. So there's osteo, then rheumatoid. Along with rheumatoid, some people might get a psoriatic arthritis. That's similar to rheumatoid because it is also autoimmune. Okay, our next one, gouty. He's the young one and he's a mess. Oh, gouty. Oh, gouty arthritis. I have him as a guy because gout affects more men than women. Okay? And a lot of people are fairly young when they get gout. Uric acid, it's caused by an increase too much uric acid in the bloodstream, which causes these crystals, which if you look at them under a microscope, they look like shrouds of glass. And it's very painful. And the most common place to get gout is in the great toe. You know, your foot. So if this is your foot and this is your big toe, it's right here, this joint, your PIP joint. That's the most common place that you'll see folks get gout. All right? But it can happen in other places, certainly. Now, there is a diet that you can go on to help hold down the purines, turning everything into uric acid, too much uric acid, but it's extremely limited diet, and most people just don't do well at it. And so the meds you can take, Xyloprim, which is allopurinol, extremely common, very common, colchicine, probenecid, and then a new one, relatively new one, is Uloric. Uloric's pretty darn expensive. Now, not as expensive as something like Humira or Tecfidera or any of those, but it's still several $100s a month, $400, $500, $600 a month. So again, understand that some of these people spend thousands of dollars on meds every month, and you need to really be careful with them, okay? Not to drop them, not to pop them out. Oh, she's in the shower, so I'm going to waste these and come back later. You still have to do everything by the book, but just be aware of the price of some of these medications, okay? So we have old osteo, which is just wear and tear. It gets to be bone on bone, and we just have to get by, and if all goes awful, they may end up with a joint replacement. Rheumatoid, which remember is the girl because more women get rheumatoid than men. It's autoimmune, the body's fighting itself, total joint destruction, red hot swollen joints. It is systemic, and the drugs to treat it, you can take one of these newer biologics. You're going to see a lot of methotrexate and sometimes some Plaquenil, occasionally some steroids. Gout caused by excess uric acid, which makes crystals in the blood, very sharp, pointy, painful. Most common place, the great toe, Xyloprim, which is allopurinol. That's on your test. And then colchicine, probenecid, and the newer one, Uloric. You have to know this one. Okay? You have to know this one. All right. Thank you.